useful. And abuse, probably not very useful, according to most studies. But a drug called naltrexone, or Revia, helps a little bit with the alcoholic outcome. A little bit meaning it probably adds about 15%, 15% to the outcome. It's very possible, and there are some preliminary data to say that this might be true regarding a particular kind of receptor called the opioid receptor. It is very possible that if you take 100 alcoholics, give them naltrexone, there'll be about a 15% improvement overall, but that there is a subgroup, probably a biological subgroup, might relate to their genetic makeup, that is responding extremely well to the naltrexone, while the others are probably not responding at all. So the genetics work not only is going to give us some information about prevention, but will hopefully tell us a bit about treatment-related issues, especially pharmacology. And the more we learn, the more we might be able to divide people up as we do a treatment trial to find out whether they have specific needs. Well, the naltrexone story is a story that is still to unfold, and there aren't a lot of data. There's one study not yet published that indicates that what I'm saying might turn out to be true. There's another drug treatment that is experimental for alcoholism, and it's a drug that affects that chemical that I mentioned earlier called serotonin. It affects it in a very special way. And that drug is called ondansetron. And every time I say that, I think of Christmas, ondansetron, on Blitzen. But ondansetron is a serotonin-affecting drug that's actually very useful in people who are taking chemotherapy for cancers because it helps fight the nausea from the chemotherapy. But aside from that, it is changing the serotonin system dramatically. And it turns out that the people with high levels of boredom but a lot of sensation seeking may respond to ondansetron once they developed alcoholism, while other people do not. There are two studies that point to that. So it may be that understanding more about a person's genetic predisposition may help to develop new treatments and may help us to evaluate existing treatments to find the population for which the treatment is likely to be most effective. There's another issue that I want to review with you, and this issue pretty much summarizes the information that I've been trying to give as part of this lecture. What it relates to is alcohol dependence is genetically influenced, but are other drug dependencies genetically influenced? If they are, is the same thing inherited that increases the risk for other drugs as increases the risk for alcoholism? Well, the answer to the first part of the question is yes. Most other drug dependencies are genetically influenced. The amount of genetic influence involved varies from about 30% to about 80%, depending on the study you read and the specific drug involved. The answer to the second part of the question is that most of the studies that have looked at this say the vast majority of the genetic influences that increase your risk for alcoholism do not affect your risk for other drug dependencies. Well, the alcohol metabolizing enzymes, as one of the risk factors that's protective, there's nothing to do with your risk for other drug dependencies. The low level of response to alcohol, nothing to do with your other drug dependencies because you don't tend to have a low response to other drugs, just alcohol. So it is probable that most, but not all, of the things that I've just talked about today as potentially inherited to affect the alcoholism risk don't impact on your risk for dependence on drugs other than alcohol, with one exception. And the one exception is if what you're inheriting, going back to that earlier slide, is severe disinhibition, you're pretty impulsive, you don't learn from your mistakes, and basically you're prone toward a variety of problems, including dependence on all drugs. So, yes, other drug dependencies to a greater or lesser extent are also genetically influenced. In general, a few of the risk factors probably apply both to alcohol and to drug dependence, but most do not. And in fact, I can take this one step further and talk about the fact that it is probable that some of the things inherited specifically for heroin-like dependence don't impact on your risk for other drug dependencies. And some of the things that are inherited for marijuana dependence don't impact on your other dependencies. And the same thing regarding a unique set of factors for amphetamines and cocaine that don't impact on your other risks. Although there are some additional factors that do overarch and reach across drugs. In general, all the drug dependencies are genetically influenced. For all of them, genes explain only part of the picture. There may be a few genetic mechanisms that increase your risk across various categories of drugs, but in general, there are also specific factors related to each type of drug dependence, probably how you react to that particular type of drug, and probably how you metabolize that particular type of drug, which are pretty unique for that type of drug. Okay, hopefully today you've learned a lot about genetics of alcohol dependence. Hopefully you've learned things that are not only going to help you a little bit to understand what's going on regarding genetics of alcoholism, but will also help you to explain things to your clients and patients as well as to their families. And you've learned that alcohol dependence, and I've given you that it's probably similar regarding other genes for the other drug dependencies, that alcohol dependence is a disorder of extremely high risk in relatives. So you've got to start thinking about prevention approaches in the children of people with alcohol dependence, and that I'm doing a series of studies to try to help you to identify specific preventive techniques that might be especially appropriate for specific kinds of predispositions. So thank you very much.
Hopefully, this technical assistance set of videos has given you some ideas on how to make treatment for your client more effective, how to keep that person out of jail, how to make them feel better and do better. The success of Prop 36 not only means fewer substance abusers, it also means less government spending, and it means improved public health and public safety. The success of your local team means the success for our entire state. This effort and your part in it is really very important, and we want to thank you for your effort.